Welcome back to Aging and Awesome. Neuropathy can be painful and can cause muscle weakness and numbness. It's common in older people and can easily be misdiagnosed. We have Dr. Brian Evans from Comprehensive Integrated Care here today to help sort that out. Dr. Evans, thank you so much for coming on the show.
Thank you for having me.
Why is neuropathy misdiagnosed all the time? Is that often?
It happens often, but I wouldn't necessarily say it's misdiagnosed. It's uncovering what is really causing the issue, whether it's nerves or, and for my case, discovering if it's related to poor blood flow in the arteries down to the feet.
And so when you ignore these symptoms, it can be even more painful. Is it something you need to get addressed quickly? And how so do people do that?
You definitely need to get it looked at quickly because it can develop into worsening blood flow to the feet, could lead to infections or wounds that don't heal, lead to pain in the legs where you're not able to mobilize as much as you should, because we all really need to be moving around as much as possible, because that in itself improves the blood flow to the feet. And then if you wait too long, it could develop into an amputation, which is a terrible outcome.
Absolutely. So Dr. Evans is an interventional radiologist, correct?
Correct.
And that's a different treatment process as an interventional radiologist. And what is that like?
So what I usually describe to the patients is we're just fancy plumbers. So what we do is minimally invasive endovascular surgery. So everything we do is through a small nick in the skin, and we can get a small wire catheter into the arteries that go throughout the body. And instead of going towards the heart, like for a cardiac angiogram, we go south down into the legs and improve the blood flow using various techniques that way.
So being minimally invasive is really important.
Minimally invasive is so many things in medicine are moving nowadays, and we're at the forefront of that because we've been doing it for decades now.
Yeah.
And minimally invasive means you go home the same day with a little Band-Aid over the small nick in the skin, but we can do some incredible work on the inside.
So there's no real downtime if you need to get this procedure done?
No real downtime at all.
And I imagine it's covered by insurance in a lot of ways, because this is a painful problem that people have.
It's a painful problem, but a no pain at all procedure. So it's a painless procedure. Patients tolerate it really well and really enjoy being able to do it in an outpatient setting and go home the same day.
And I'm sure you have a lot of great testimonials, people that are like, I'm so glad I can golf again, or ride my bike again, things like that.
Incredible testimonials, and patients are more than willing to help out and spread the word about what can be offered and how it can really improve their lives.
And when it comes to pain in general, it's just so important to get pain managed in that way, where it's not necessarily through drugs. I'm assuming this is a procedure, right?
Definitely. We try, and we not only do we work with blood flow, but we do multiple other types of procedures that help out with pain to allow patients not to be on any long-term oral narcotics or opioids. This is all done in an outpatient setting, so you're not having to go to the hospital and deal with difficult parking, finding your way through the maze of the hospital, where you park right in front of our office, go in, meet some great staff, and you're walked through the whole process and leave better than when you came.
And where is your office located?
We're on Kitsky, close to the new Ranchera.
Wonderful. Great location.
Yeah.
Dr. Evans with Comprehensive Integrated Care. Thank you so much.
Thanks.